It's nice to be a primary care doctor because it's good to be sort of the first person a patient sees. I do encourage patients to bring questions with them at the beginning of the visit to just make the visit go more smoothly, actually. About a month ago, I had a young patient. She came in for a routine physical as a new patient, and it was a normal exam. She had no medical issues that we knew about. But then I said, "Do you have any more questions?" And she said, "Oh yeah, by the way, my mom had hepatitis B when she delivered me, and they said I may have had it too, but there was no actual follow-up on that." So then that led to a few questions, obviously. So I was like, well, now you're 30 years old, that could be potentially serious. So I said, in addition to the blood work that we normally did for her, I said, well, we certainly want to now check you for hepatitis B. So we did check for it, and lo and behold, she actually does have hepatitis B. Now that she's 30 years old and probably had it since she was born, it would have been a very bad situation decades down the line if she had not gotten treated. So I think people should trust their instincts in terms of asking questions to doctors. I would have never known about that. I mean, I could have maybe at some point asked her, "Oh, by the way, does anybody have hepatitis in your family?" But I mean, without any risk factors, I probably wouldn't have said that. The best way for a doctor-patient relationship to be successful is for a partnership to exist. You want to be doing the best for them, they want to do the best for themselves. You ask them questions, they ask you questions. There has to be a trust, of course, and a bonding, but it has to be a partnership.